Guys, Michelle and Dr. Hashmi here with Plant-Based Kidney Health. And the question for today, Dr. Hashmi, is how important is sleep for kidney health, kidney disease? And what about things like melatonin, magnesium, different herbs that people use to try to sleep better? Are those things that people should be using if they have kidney disease?
Yeah, sleep is such an important part of our overall health. It doesn't matter if you have kidney disease or not. If you're not getting enough sleep, there's so many issues that end up happening. For example, what we're starting to find is that one of the functions of sleep is to act as a washing machine for a brain going on. So when you sleep, there's all this lymph fluid that's floating around, and it's actually cleaning out a lot of the proteins like that amyloid protein that we talk about. So those amyloid proteins are very sticky, and over years and decades, they stick inside the brain. But when you get adequate sleep, your brain is actually doing its laundry. It's cleaning the brain out. And that's why not just quantity, but the quality of your sleep is incredibly important. Now, other parts of sleep that are very important is if we look at obesity, one of the biggest causes of going on kidney disease dialysis is extra weight. So when we talk about things like obesity, for example, what we know when it comes to sleep is if you sleep less than 6 hours a night, there's a fascinating study that was really well designed. What they showed was that on average, people were eating an additional 300 calories the next day. It's not because they were told this is a weight loss study or anything else. They were actually told that this study was looking at how well they perform on mental tasks if they don't get enough sleep. But what it was fascinating was that they would just eat more. So think about that the next time you're not sleeping enough. And if your goal is really to get healthier and lose some weight going on, sleep is critical for weight loss. And then when it comes to CKD, what we don't know is essentially the chicken or the egg phenomenon. Does CKD cause worsening of insomnia, or is it that somehow a lack of sleep, which causes inflammation in the body, then leads to chronic kidney disease? The answer is, I don't know. We're still kind of working those issues out, but regardless, we know half of the patients who have chronic kidney disease have poor sleep quality, have some sort of insomnia going on. And if you look at people who are actually getting dialysis, PD or hemo, their sleep is even worse. This is based on a new study that was out of Kidney Medicine 2022. So when we look at normal sleep physiology, what we know is
Dr. Hashmi and I have we've been battling colds and we're getting over it. So excuse us, we need our water and coughing and stuff. Oh, I know it's the worst. Do you have water? All right, you guys. And then while Dr. Hashmi's doing that, he's going to dive into some of the things that you can do to help improve your sleep. And I think that's going to be a really key thing to, tune in for. Aside from, again, we're going to talk a little bit about, supplements that we get asked about, things like melatonin and magnesium. But I think, you guys know that our approach is if we can start with things that aren't, medications and supplements and just habits around lifestyle and diet and exercise and sleep, then we want to start there. So we'll get into that a little bit more, but we're back.
Sorry about that, guys. So let's get back to the normal healthy individual. When we look at healthy individuals, what we find is, in general, there's a whole diurnal cycle or there's a circadian rhythm that your body follows. And when you sleep, you actually have a decrease in your sympathetic drive. So in other words, your sympathetic is more like fight or flight, makes you active, makes you excited going on. And sleep in the evening time, all of that sympathetic activity is supposed to go down, and your vagal tone is supposed to go up. This is why when we look at blood pressure, you're supposed to have a dip in your blood pressure in the evening. So we call those dippers going on. We addressed that in a previous one of our episodes going on where we talked about the fact that nocturnal dipping in your blood pressure is actually healthy. You want to see that. The reason this is important is because when you have chronic kidney disease, you actually have the opposite effect. So with CKD patients, their sympathetic nervous system is always revved up. And because it's always revved up, they have a much harder time relaxing and falling asleep. So that's why people talk about things like, well, can I take some magnesium? Can I take some herbs? Can I take some other stuff? We're going to talk about all of those, but let's hit melatonin, because melatonin is probably the most misunderstood substance out there today. So melatonin is secreted by the pineal gland. It's supposed to help you with the sleep-wake rhythm in the sense that it can help you fall asleep, not stay asleep going on. And we know that levels of melatonin are much lower in ESRD patients. They're definitely lower in CKD, but dramatically lower in ESRD patients. So then comes the question, well, if our levels are lower, shouldn't we be supplementing with melatonin? So let's take a look at the data and not people's expert opinions. By the way, most people who take melatonin, they take these gigantic doses, which are absolutely harmful for us, because what they're going to do is shut off our own melatonin production going on. So when it comes to melatonin and the research out there, there isn't a lot going on, but what they did show is there's a study back in 2005 where they said that if you got a kidney transplant, so remember, ESRD, very low melatonin, where you would think if I gave you a kidney transplant, the melatonin would shoot up. What they found was that the melatonin concentration does not improve with kidney transplant. So in other words, even after transplant, most of our kidney patients, they still struggle with sleep. And this is a challenging option still going on. So there was a 6-week randomized double-blind crossover trial. And in it, and this was back in 2013, it was the Indian Journal of Nephrology, they used 3 milligrams of melatonin. And what they showed was that 3 milligrams of melatonin versus placebo did improve sleep quality, sleep efficiency, and sleep duration in CKD patients going on and in dialysis patients. But this was only 6 weeks. So the question is, what happens if you continue this longer? So there is another study. This study was the British Journal of Clinical Pharmacology, 2013. And in this particular one, what they were really looking for was not about efficacy. They just wanted to know, is melatonin safe for up to a year in our patients who have chronic kidney disease and ESRD and so forth going on. So what they found was, yes, melatonin was safe for up to 1 year, but guess what? The effects of melatonin disappeared after 6 to 12 months. So in other words, at 6 to 12 months, taking melatonin, and most people were taking about 3 milligrams, it really did not function. So if you're listening to this and watching this right now and wondering, okay, well, melatonin doesn't work, what else can I take? Well, it actually turns out the most effective thing out there is not a pill. It's cognitive behavioral therapy. CBT is incredibly effective, but people don't like CBT because it takes practice. You have to practice every single day. And what is it? So if you can't afford to go take a program, and there's all sorts of, by the way, amazing YouTube videos that you can watch, and they're designed so that you can break them apart, do it over weeks, and learn CBT on your own. But if you can't do that, let me give you sort of the really quick, down and dirty 30-second summary of it, which is the first thing you want to do is make sure that you wake up at the same time every single day, 7 days a week. That's number one. That is the most important thing. We work backwards. We don't worry about the time you go to sleep. We start with the time you wake up. Number two, make sure that you use your bedroom only for sleep, only for sex going on. Anything else, don't stay in the bedroom, right? Watching TV, don't put a TV inside your bedroom going on. When you're ready to do anything else, get up and leave. If you're not sleeping or if you're having trouble sleeping, get up, leave the bedroom, come back when you're ready to sleep going on. This is psychological because what we're training your brain to know is that this is the place where you go to sleep. And because of that, that becomes very important. Of course, making sure there's no lights, right? Any lights or any kind of blinking stuff, anything you have, you got to turn it off. Make sure your phone is on Do Not Disturb so you're not getting any text going on. And wear a mask. Eye masks are spectacular because you'll be surprised how even the slightest light can make an impact. And eye masks can do wonders for helping get deep, restful sleep. Next is exercise. The best time to exercise is first thing in the morning, not later, because what you want to do is you want to be able to set up your entire routine with the morning first. Wake up at a fixed time, go work out, start your day. If you work out later in the evening, because of CKD patients having higher sympathetic drive, it's going to take you much longer for you to calm down. So it's more concerning there. Number two, liquids. 4 hours before bedtime, try not to drink liquids because they haven't processed through the kidneys yet. Therefore, you're going to wake up in the middle of the night and you're going to want to go pee. If you want to avoid that, 4 hours, 4 is the magic number. 4 hours before you go to bed, you got to make sure you don't do that. Nicotine, alcohol in the evening, those are all things that are big no-no. Nicotine is a no-no anyways going on, so make sure you understand that. Now for herbs, ashwagandha is something that I love. I'll have an episode on it. But when it comes to transplant, you want to be very careful. Ashwagandha can actually stimulate the immune system. And there's a case study in Kidney International Reports in 2020 where a patient actually lost their kidney. It rejected because of the fact that they started taking ashwagandha. It caused their immune system to attack and kill the kidney. So any kind of herb, especially in kidney transplant, you have to be very, very careful. Now, on the flip side, the data on the protective benefits of ashwagandha, for example, against animal models where they tried to add gentamicin-induced kidney failure, ashwagandha does great at protecting the kidneys against that. But it's one of those things where you have CKD, you've got to talk to your doctor about it and make that personal decision. Magnesium is really hard to get toxic of magnesium. And what magnesium does is it tends to relax us. There's about 10 different types of magnesium. So knowing which type to take is important. It makes a little bit of a difference, but generally speaking, all magnesiums will help to calm you down and relax you. So when people say, can magnesium help for sleep? Indirectly, it's helping to calm down, relax, because of the fact that your sympathetic drive may be overactive. And magnesium has so many incredible benefits, especially in CKD patients, including things like binding to dietary phosphate going on, helping to improve your phosphate control, reducing vascular calcifications going on. It's right up there with things like vitamin K2. It's just that vitamin K2 we're talking more about now, but magnesium is an old, tried and true thing that is actually very, very helpful to us. So the bottom line when it comes to sleep is melatonin, most likely for really short terms. Yes, it could help you. The dosage would be around 3 milligrams, but the data shows that around 6 months probably doesn't work so well. Sympathetic drive is a big deal. And the last thing is please, please, please focus on CBT as the best